Minneapolis Mayor Jacob Frey just issued an executive order to deprioritize the enforcement on the use of certain psychedelics. That includes silocybin mushrooms, ayahuasca tea, and more. To break down this new issue, Fox 9's Minneapolis Rob Olson, he is joining us for more of Mayor Frey's decision. And Rob, I just want to ask, how are people in the Twin Cities responding to this news?
Well, it just came out today, so I haven't really had time to gauge reaction to it. The mayor said that he's not really heard at this point any pushback. He expects that he probably will. He does pretty much with any decision that he makes, but at this point, he's not heard anything today. Now, the executive order, and in my interview with him today, he stressed that there are some very well-researched benefits to these entheogenic plants, as they're known, on trauma and depression and other things. Now, the director of addiction medicine at the hospital here in downtown Minneapolis, Hennepin Healthcare, said that the research is certainly very promising. He cautioned that he thinks the language in the order might suggest that the research is further along than it is and may encourage people to self-medicate rather than seek professional treatment for some of these. But other than that, he said, when it comes to decriminalizing things like this, he fully supports this move and this order.
This does not decriminalize, nor does it make legal. That would be subject to statute, a law.
Mayor Jacob Frey says they began meeting about a year ago with experts on entheogenic plants, the things like mushrooms and psilocybin, and looked at what other cities and states have done.
The message that this is sending is that our prioritization is focused elsewhere. And by the way, it should be.
And that's what led to this executive order deprioritizing police enforcement, noting that people use the compounds for trauma and depression.
But if somebody's dealing, that's a different scenario.
You still can't deal, right? No, you still can't do any of this stuff, by the way. It is still, just to be very clear, illegal.
Law enforcement has much better things to do than go after people who happen to have some psilocybin on them.
The director of addiction medicine at Hennepin Healthcare says he very much supports the mayor's order, is not worried it'll lead to proliferation, but also has mixed feelings it could overstate the benefits.
The science isn't quite there yet, and to not think that these are yet officially sanctioned or legitimate or effective medical treatments.
He says there is promising research into potential benefits, but that people shouldn't self-medicate instead of seeking proven treatment.
But at this point in time, we don't have sufficient evidence to really show that they're ready for prime time.
I don't want cops worrying about shrooms when they should be worrying about violent crime and the illegal sale of fentanyl, which can wreak havoc on people's lives and a city and neighborhoods as a whole.
Have you gotten a lot of pushback today?
No.
No.
I haven't.
So there, yeah, you hear the mayor's focus here. Really, in our brief interview with him today, he really emphasized that over and over, that this is a deprioritization, meaning allowing the police officers to focus on more important things. And he stressed, too, that they already do that. Much of this is removing the stigma around these, and again, with possession. But it does also very much state clearly in the order that they will still be prosecuting cases because it's still illegal. So if you're possessing a small amount, that's one thing. If you're dealing it or have larger amounts, then that is something else. Back to you.
Yeah, Rob, but this could be the first step for Minnesota to legalize potentially psychedelics. Can you talk more about that movement? And is there anyone else from the political side that is behind this, such as Mayor Frey?
Well, we have not really heard any other movement on this. There is a task force, though, at this point that was established by the state legislature this spring to set up to study this for medicinal use, for healthcare use, to use some of these compounds and plants in a clinical setting rather than just in research, to study whether that they can be used by addiction and trauma specialists, again, in a prescribed sort of way, not to fully legalize them. So there is that movement already afoot. Again, this is a movement to, again, prioritize law enforcement, to remove the stigma, is what Mayor Frey said, around the possessing these. Because as the addiction director said here at Hennepin Healthcare, there's not widespread issues at this point with overdosing, for example. That's not something that they deal with, but certainly they would like to see people seeking out treatment if they need it for these, and maybe be enrolled in a study to have this done in more of a guided setting. But again, there is movement to really look at them in terms of making them part of a physician setting for treatment and the benefits of use. And there's a number of studies that are going on looking into that. And as the doctor said, they do show a lot of promise, just not very clear, concrete data at this point.
And Rob, Minneapolis hardly the only city trying this approach. Did the mayor mention to you looking toward other cities and how they're handling this issue, maybe taking some points from them?
He did. He said that over the past year, when they put together their own advisory group of experts in the field to talk about this, but then did look at other cities and states and what they've done. And there have been other movements just like this elsewhere that they say has been effective in removing that stigma and to make sure that law enforcement isn't tied up with what they consider really a low-level offense, and instead going after the higher public safety issues. So they did do a lot of that before they sent out this order today.
Fox 9's Rob Olson, thank you so much. Always a pleasure to have you here on Live Now from Fox, and we hope to welcome you back and see where this goes in the future.
All right, thank you.